But now we are joined live in the studio by Dr. Marco Diaz with Las Palmas del Sol Medical Center. And first and foremost, thank you for taking some time. But we want your perspective as well, because you are an emergency room doctor.
Yes, sir.
So when you receive a patient who has suffered this type of injury, it is obviously very important. We don't want to speculate on what may or may not be happening with Damar Hamlin. We only know what we know up to this point. But just when you receive this type of traumatic injury from a patient, what happens?
Well, it's like you were saying. I mean, this is one of those historic moments that you look back on history and just, I've never seen this before. In my lifetime, nothing like this has been witnessed. But you know, you're right. It's you get a patient like this that comes into the emergency room. You have to, your brain is going off thinking, what's going on here? And you know, the heart it's an electrical organ. Any insult, whether it be traumatic, you know, chemical, electrolyte abnormality, you have to run through all those scenarios. But first and foremost, I mean, NFL is a very traumatic sport, you know. So you have to assume that it's probably some kind of contusion or bruise to the heart, causing a potentially life-threatening arrhythmia. So you mentioned he got CPR. You know, from witness reports say he was intubated there in the field directly. So you know, when he comes in, you try to stabilize the patient immediately. And I imagine the trained personnel who were at you know, first responders, I think they did what they had to do immediately. Once he comes in, you assess the patient, you see what's going on with the heart. Is it a heart attack? It could, you know, you have to think about that. I know he's 24 years old, prime athlete, but you know, is it a heart attack? Is it an arrhythmia? My guess in the situation, like you were saying, it's probably due to the direct blow to the heart, which it appears innocent when you first see it, and then when you see him collapse, you realize, oh man, something so innocent can potentially change the scope of the whole deal. So. And
I do want to impress to people, we are not showing the play itself, the collapse, because it is a very difficult thing for a lot of people to watch. Of course, if you were watching the game, you saw it live. They showed a couple of initial replays, which is something that's common when you're watching an NFL game, any sporting event. You'll see severe injuries that can happen. They may show one replay and then not show it again. But then I think people quickly realized just how severe the situation was. When you saw the initial contact, he looks for the first maybe split second like he's just going to walk back to the huddle, everything's normal, and then all of a sudden to see a 24-year-old NFL player, premier world-class athlete, just collapse like that. What are you thinking?
Oh, I mean, tragic immediately. And immediately when I was having family, I was at a dinner with my family at a restaurant, and I witnessed it, and immediately I was like, oh my God, this is serious.
And you knew right away?
Right away, this is absolutely serious. A 24-year-old prime athlete does not collapse on a random occasion, you know what I mean? So yeah, it was one of those things where, you know, as ER physicians and, you know, medical personnel, we're trained to see little subtle things that unfortunately can just have a dramatic impact. And seeing that impact, again, it seemed innocent, but the collapse was, he sat there lifeless. So yeah, my immediate response was like, this is very serious, and it's in ripples, I'm sure, throughout the world and sports community. And I'm sure, you know, parents of young athletes are seeing this, and like you mentioned earlier, is this something that they want to consider keeping their children in? And with obvious concern. And I would, you know, I'd like to reiterate that yeah, you know, all these sports, any sports is potentially life-threatening if you do the wrong move or the wrong event happens to you. But you know, I think the importance is, you know, that you have medical trained personnel, easily accessible, and we were talking beforehand. It's the importance of kind of everyone being aware of CPR, because you know, as it can happen to an athlete, it can happen to you, it can happen to me at any moment. So I think the immediate response is, you know, getting somebody who knows what they're doing. And starting immediately, because you know, at this point, you know, time is of the essence.
Time is of the essence, and the latest reporting we're hearing out of Cincinnati, they thought maybe there would be some sort of news conference tonight outside the hospital with some type of update. The latest reporting from ESPN is that that is not going to happen tonight. I don't know if that we want to read too much into that, but in terms of what happens in the overnight hours and in the critical 24 hours right now that we're going through, what ultimately would you be looking for in terms of him potentially making a full recovery?
Well, I think the other thing to mention is he did go to a, very academically
Level 1 trauma
level
center,
one
University
trauma
of
center,
Cincinnati.
very well-renowned
Sure.
institution. So I'm sure he's getting the highest level of care there that can be provided. But yeah, the first seconds immediately, it's like, what's going on with his heart? Is this an arrhythmia? Let's stabilize it. Let's do what we can. Give him medications, and I'm sure you get the cardiologist involved as soon as possible. You get the trauma surgeons involved. See if there's anything that can be done. But yeah, those first hours are just stabilize him. If there's anything procedure-wise, it has to be done immediately. If that's done, monitor him, hour by hour, second by second. So yeah, I think it's kind of premature
Sure.
to say anything at this point.
Yeah, we don't want to speculate on
Yeah, you
anything.
don't want to speculate. You have to assume trauma, but there's a bunch of other differential diagnoses that have to be evaluated. But I am sure he's receiving the highest possible level of care, and it's just one of those things that it's a moment by moment situation. And
Dr. Marco Diaz, emergency room doctor for Las Palmas del Sol Medical Center, thank you so much for taking some time and your perspective
Our
tonight.
prayers go out to the players.
And the reactions are pouring in. We will have some of those coming up for you right after this. You're watching ABC 7 at 10, where news comes first.